Today, we are going to be talking about how hernia repair with mesh results in significant improvement in quality of life. Recently, both media and patient interest regarding the safety of mesh has become an increased topic of interest. However, there is a lack of data regarding health-related quality of life outcomes in patients who undergo inguinal hernia repair with mesh. We aim to report both short and long-term post-operative quality of life outcomes in patients following inguinal hernia repair with mesh. 1,735 patients who underwent inguinal hernia repair with mesh between 2008 and 2019 at a single institution were identified from a prospectively maintained quality database. Health-related quality of life information was measured using both the Surgical Outcomes Measurement System and the Carolinas Comfort Scale surveys. These surveys were administered preoperatively and postoperatively at 3 weeks, 6 months, 1 year, 2 years, and 5 years. Patient and surgical characteristics are shown here. 89.4% of patients were male with an average age of 60 years old. Only 0.2% of repairs were emergency repairs, and 13% of repairs were being performed on recurrent hernias. The majority of cases were performed via the laparoscopic approach. 7.8% of patients were also undergoing a concurrent repair, and 1.3% of patients experienced an intraoperative complication. Intraoperative complications are shown here, with the majority being peritoneal tears. Postoperative outcomes are shown here. 3.9% of patients went to the emergency department within 30 days of their operation, and 1% were readmitted within 30 days of the operation. 0.3% of patients experienced a surgical site infection within 30 days of the operation, and 1 patient experienced a mesh infection that required mesh explantation. 2.1% of patients developed a recurrent hernia after the operation. SOMS pain scores are shown here. All of the pain domains improved significantly from baseline. At 5 years postoperatively, the percentage of patients indicating non-bothersome symptoms were 89% for sensation of mesh, 91.7% for pain, and 90.4% for movement limitations. Though mesh use has been scrutinized, this study found that inguinal hernia repair with mesh results in a low rate of complications. Both short and long-term quality of life survey scores all improved from preoperative surveys, and at 5 years, the majority of patients experienced either none or non-bothersome symptoms. Thank you.